historic day across Yellowstone County and Montana. Finally, a light at the end of the tunnel in the fight against COVID-19. From arrival to dispensing, it didn't take long for local healthcare workers to receive the first round of COVID-19 vaccinations today. Well, a sign of hope as health authorities across Montana report 29 more deaths related to COVID-19. 15 of those additional deaths are from right here in Yellowstone County. However, Riverstone Health tells us that this large number is mainly an update of additional deaths between September and December. Now, several neighboring counties also reported deaths today, including Bighorn County, where the death toll there has now reached 58. Well, 5 Billings Clinic staff members across the healthcare spectrum received the first Pfizer COVID-19 vaccines today. Q2's Mitch Laggy was there to show us how it all unfolded.
Tuesday was truly historic for 5 members of the Billings Clinic staff, who were among some of the first in the entire state of Montana to receive the Pfizer COVID-19 vaccine. Billings Clinic CEO Dr. Scott Elner said that he hopes this is a turning point in the fight against COVID-19. Hospital staff gathered in the Billings Clinic Commons to watch the vaccines be administered. The 5 people receiving it represent different aspects of the healthcare system, with a physician, nurse, respiratory therapist, environmental services staff member, and Billings Fire Department paramedic all receiving the vaccination.
The people here today are true heroes. They're on the front line. They have been exposed to patients with aerosolization of particles of COVID-19, and we want to make sure that they're in the first line to get the vaccine. Billings
Clinic received 975 doses of the Pfizer vaccine, with major distribution scheduled to kick off on Thursday. The vaccine will be given out on a voluntary basis to Billings Clinic staff and Billings Fire Department paramedics. Once those vaccines run out, the clinic will have to go to the state to get another allocation, the goal being that eventually the vaccines will make their way to the wider public.
The state is on an allocation schedule, and we'll be able to continue those vaccinations, not only with Billings Clinic, with also the family medicine residency from Riverstone, from our anesthesia partners, and continue to expand that to the community as soon as we have enough allocation available.
For healthcare workers that have been putting in extra shifts to care for the high volume of patients, respiratory therapist Michelle Buffington said she hopes the vaccine can help lift their spirits after this year-long fight.
As healthcare providers, we're all just kind of at that point where we're exhausted, and physically, emotionally, it's, and I think everybody's kind of ready to move on. And somebody has to start it. Everything that we've done with our COVID patients has been experimental. There's no definitive way to treat them, so we're kind of always throwing in the kitchen sink and doing what we can, so there has to be something better.
Fire Department paramedic Jason Banfield said his vaccination was just like getting his annual flu shot, and he hopes the new drug will help keep his family and the city he serves healthy.
I think it's important that people kind of lean forward and look at the whole group of our population, and and we need to just take care of each other, and this is one way we can do this.
In 21 days, the 5 people that had the vaccination will have to come back for a second dose of the new drug. In Billings, Mitch Laggy, MTN News.
All right, thanks so much, Mitch. Now, it's going to take more time for a vaccine to reach rural critical access hospitals across Montana. Many of those hospitals do not have the cold storage required to keep the Pfizer vaccine and will have to wait for the Moderna vaccine, which can be stored in a standard freezer.